going to start with Ms. Reg, a couple questions. I've heard from Iowa independent agents and brokers about the new federal requirements to record all phone calls with seniors and to store the audio files for 10 years. So can you say, is this the most effective way for federal regulators to conduct oversight, and are there more effective ways to ensure quality?
Thank you, Senator. While the SHIPs are impartial and focus on the Medicare beneficiaries, the patients, the caregivers, as a SHIP that sits within insurance, I know that was a struggle for many of the independent agents to take on that added request for recordings. And as shared previously, those typically aren't the bad actors. It's oftentimes large brokers, activity that happens out of state that is consequential for our Medicare beneficiaries ending up in the poor plans. I believe recording the calls from the lead agencies, the third-party marketing, and the out-of-state brokers may have had an impact. I'm unaware of if there have been results or data taken from that. I'm not sure it was effectual with the independent agents.
Another question for you. In addition to the current Medicare open enrollment, Medicare Advantage enrollees can change plans or switch to original Medicare in the first 3 months of the year. This was added in 2016. Currently, this open enrollment is not available for Medicare Part D plans. Iowans have told me that sometimes their Medicare Part D plan pharmacy benefit manager switches the tier placement of a patient's drug during the plan year. This change can increase the patient's out-of-pocket costs. Is this a common problem, and should there be an additional open enrollment period for Medicare Part D?
Yes, SHIPs, I believe, would support that. So we have the open enrollment every fall, October 15th to December 7th. Ideally, in a perfect world, every Medicare beneficiary would accurately review their health and drug options and be in the best plan come the new year. However, we often have to use January, February, and March to review different Medicare Advantage plans, and we don't have that option for the individuals that are currently in original Medicare with a standalone plan.
Ms. Hoagland, Medicare Advantage enrollment continues to grow as a percentage of Medicare enrollment. When I led and passed the 2003 Medicare Modernization Act, 5 million seniors were enrolled in private health plans. Today it's 30 million. Why are seniors choosing to enroll in Medicare Advantage plans compared to the original Medicare?
I appreciate this question. I agree. I mean, I think Medicare Advantage is an undeniable success and offers pretty high quality coverage to a lot of Americans. It is one of the only federal programs that measures and rewards high quality. So I think there's an element of that that beneficiaries can see what plans are considered high quality, and that is something that's an advantage over other programs. It also, I think, can be a very valuable program for rural populations and underserved populations. And so I think that's another reason perhaps why we've seen some of the success. As was noted earlier, definitely the additional benefits are also some things that really do appeal to our seniors and can help with more well-rounded support for all of their needs, not just their medical needs, perhaps some of their social determinants as well.
Yeah. Mr. Blumenfeld, question about PBMs for you. They can have a significant impact on a senior's access to prescription drugs and how much they cost at the counter where they get their drugs. How does your company help seniors navigate challenges created by PBMs so seniors can access a local pharmacy of their choice?
At Chapter, we look at every single Part D plan and every single prescription and every single option of where someone could fill that prescription. That data is unfortunately not available online. The government does not publish it. Insurance carriers do not publish it. Chapter is the only organization in the country where you can actually get accurate information on where to find a prescription at a specific price on a specific Medicare plan. That should not be true. It unfortunately is. So what we do is we look at all of that data and we recommend a plan that minimizes costs given someone's prescriptions and given any potential prescriptions they may need to take throughout the year.
Yeah. And for you and Ms. Ragg, this question, what steps have your organizations taken to ensure that rural Americans receive quality and timely information?
There we go. For the SHIP program, we rely on partnerships. Partnerships with the local area agencies on aging, partnerships with faith-based organization, partnerships really with anybody that'll partner with us in those communities to disseminate information timely and accurately to those populations, just as we would those in our metropolitans.
Mr. Blumenfeld?
I think it's really important that we continue to provide more information to consumers so that they can make these really difficult decisions. I think without that and without better regulation and oversight over brokers themselves, there won't be much improvement.
Thank you, Mr. Chairman.